Thanks for looking over the house while we're on vacation. You're such a great neighbor.
No problem. It sounds like you're going to have a great time.
Come on, Mom. Let's go already.
Just a minute. Go get buckled in. I'll be right there.
Wow, I'm impressed. If I were them, I wouldn't be so eager to get in a car anytime soon.
That car accident was horrible. And when they got out of the hospital, they were anxious to get into a car again. But we got some help.
Yeah?
We went to the Children's Advocacy Center. Their therapist was great. She really helped me learn how to help them get over the trauma of their accident.
I loved working with Sarah, Charlotte, and Jordan. They were ideal candidates for a Child and Family Traumatic Stress Intervention, or CFITC. It's a program that helps children ages 7 to 18 who have recently experienced a trauma.
Felicia is just one of our fantastic CFITC therapists. Here at the Children's Advocacy Services of Greater St. Louis, we've been helping families overcome trauma for nearly 3 decades. With locations on the UMSL campus, in Kirkwood, and in the Central West End, we strive to make treatment accessible for families across the St. Louis metropolitan area.
Our grant from the Substance Abuse and Mental Health Services Administration is helping us expand the services that we offer. Project Contact has allowed us to increase the number of clinicians on staff who have training in the CFITC model. One goal is to partner with child-serving agencies to increase referrals to our CFITC program. Many community agencies are currently supporting our efforts.
But we're also interested in receiving referrals from anyone in the area. I receive dozens of calls each week from families seeking to get help for their children who have recently experienced a trauma.
Although Sarah and the kids came to us to learn how to cope with the trauma of that horrible car accident, CFITC is great at helping kids who have experienced any type of trauma, whether that be physical or sexual abuse, witnessing community or domestic violence, or surviving a natural disaster.
CFITC is a brief evidence-based program developed by the Yale Child Studies Center. Consisting of just 5 to 8 sessions, it has been demonstrated to help reduce the likelihood of a child developing post-traumatic stress disorder after experiencing a trauma.
We know that sometimes families experience barriers that prevent them from fully participating in therapy. That's why we have staff like me, a family engagement specialist, to help out. Whether it's finding transportation, care for siblings, or rental assistance, I'm here to make sure that families don't have any of those extra worries that might get in the way of attending CFITC.
Best of all, our services are completely free, and we have a very short wait list, so families can start receiving therapy soon after being referred.
I don't know what we would have done if we hadn't have found out about the CFITC program at Caskell. It's great to see the children so happy and carefree again.
And don't forget about Miss Felicia. She's awesome.
To enroll your family in CFITC or to make a referral, please call the Children's Advocacy Services of Greater St. Louis intake line, 314-516-7330, or visit our website, www.projectcontact.org.